Hi viewers and welcome back. Today we are going to discuss about carolis disease, which is a very rare inherited disease of the liver. Carolis disease is a rare inherited disorder characterized by cystic dilatation of the bile duct within the liver. It is also called as communicating ectasia or congenital cystic dilatation of the intrahepatic biliary duct. It is usually associated with liver failure and polycystic kidney disease. When we come to the classification of carolis disease, we have two types: the simple or focal carolis disease and the diffused carolis disease. In simple or focal carolis disease, there is abnormally widened bile duct affecting an isolated portion of the liver and is usually called as carolis disease, whereas in diffused carolis disease, portal hypertension and congenital cystic fibrosis are usually presented and it is normally called as carolis syndrome. When we come to the incidence or the prevalence of the disease, 1 in 1 million are usually affected by this condition. The cases of carolis syndrome are reported more commonly than the carolis disease. It is associated with other hepatorenal fibrocystic diseases as nephronophthisis 13, Meckel's-Gruber syndrome, Koch syndrome, Gobert syndrome and the related disorders, Bardet-Biedl syndrome and oral facial digital syndrome. The common signs and symptoms present in carolis disease or syndrome include fever. Sometimes there is an intermittent abdominal pain and there is also history of hepatomegaly. Some patients even complain of polycystic kidney diseases, and sometimes there are evidences of cholangitis and bile stones are also commonly present. Patients may also present with biliary abscess and sepsis with some other condition. There may be also liver cirrhosis and kidney failure, which is also common. Some patients have presented with cholangiocarcinoma and portal hypertension. We also have to find out whether there is enlarged spleen and hematemesis present with some clients, and also some patients report melena. When coming to the causes, it is a genetic disorder. In carolis disease, the cause is autosomal dominant trait, whereas in carolis syndrome, it is because of the autosomal recessive trait. The incidence is high with females than the males. There may be a related history of liver and renal diseases running in the family with carolis disease. Diagnosis is usually done with imaging techniques which includes MRI, CT, X-ray technologies which shows enlarged intrahepatic biliary ducts due to ectasia. Tubular dilatation of the bile ducts can be visualized using an ultrasonography. Fluid-filled tubular structures extending to the liver can be identified using a CT. A high contrast CT is used to differentiate stones and widened bile duct. Protrusion of the intrahepatic biliary duct can be seen as dots or linear streaks in a CT scan. The central dot sign is usually done to confirm the diagnosis with a CT or ultrasonography. The confirmation of the diagnosis is made with cholangiography, which shows the enlarged bile ducts. The treatment of carolis disease usually depends on the site of the area which is affected. In cases if there is involvement of only one lobe, then hepatectomy helps in reducing the signs and symptoms of the disease and thereby preventing malignancies. Antibiotics are commonly used to treat the infections and the inflammations of the bile duct. Ursodeoxycholic acid is used to treat hepatolithiasis, and ursodiol is used in the treatment of cholelithiasis. Conservative or endoscopic therapy are used to treat complicated cases of Carolis disease. The other procedures which are commonly used in the management of Carolis syndrome and disease include internal biliary bypass procedures, liver transplantation in selected high-risk cases in which no other therapy is effective, which can prevent cholangiocarcinoma in the future. Surgical resection in cases of monolobar involvement is preferred. Regular follow-up with ultrasonographies and biopsy reports is usually recommended. And when we come to the prognosis part, usually it is very poor. The mortality in most of the cases are due to the complications of the condition. After cholangitis, the patient dies within 5 to 10 years even with treatment. Hope this video was interesting and informative. Thanks for watching and subscribe for more videos.